All right, very good morning to everyone. Good to be here on a rainy Sunday morning. Very rare occasion, right, to have events and talks on weekends. So on that note, thank you very much. So without further ado, thanks for the intro, Mr. MC. Let me briefly run through what we have been successfully implementing in Malaysia. In fact, the earlier forum was very well moderated. Very impressive to hear about words about digital twin, interoperability, even adoption of AI among the doctors and clinicians, right? And first and foremost, I'm not a doctor, so completely a technologist, an engineer by background. And whatever we have been sharing today is from my personal own experience in the healthcare industry. And most importantly, they have been implemented in Malaysia, right? So these are based on real pain points that patients, nursing team, even doctors and CEOs and COOs of hospitals have highlighted to us. Right, so I think the global health crisis is inevitable in terms of the manpower, the workforce, the resources, as well as the key factor of infrastructure depending on the respective countries, right? And Malaysia is definitely one of them, and we all are aware of this. Whatever the MOH is doing, whatever the ministers are actually stating, and most importantly, there is no quick fix, right, on the human resources issue that we not only Malaysia, even the entire world is actually facing, right? So the key word here is that the manpower issue, whether it's being doctors, a nursing team, or operational team, it will be an ongoing process because of economy, because of talent, and because of other social, political issues as well. So what are we going to do about this? Well, just to set the context right. So what I'm going to talk about today, it's basically two key elements. Number one is actually going digital in healthcare premises. 93% by adopting or implementing IoT and AI in healthcare premises, you can expect to reduce your time, enable better patient experience, faster clinical decision making, and of course, enhance healthcare employee mental health and capabilities, which is generally part of the SDG. So now let's look into a smart hospital subsystem, right? So everyone talks about smart city, smart manufacturing plant, smart clinics, right? Or in the healthcare context, everybody wish to have a smart hospital ecosystem. And the smart hospital, basically, it's a very ambitious project. It can be an ambitious vision because you may have your hospital up and running and you can't stop the complete operation and digitalize your solutions, right? You can't do that at all. So business has to go on. At the same time, you have to digitalize whatever that you can. So what we have actually successfully done and what we have also worked with many hospitals is that we look into the wards, right, where you have your inpatients. Of course, you can look into digitalization of your pharmacies, your outpatients, where you have queue management systems, basically your labs, and so on and so forth. Just to set the context right, when I talk about smart hospitals, smart ward solutions, IoT and AI, it is not only confined to the hospitals. We can also look into senior care living, assisted living, which is mushrooming in Malaysia. It's trending from Kedah up to Johor. Every property developer is actually building senior care homes and senior care living. So, and who's going to manage them? We're going to talk about caregivers. You're going to talk about operators who are going to manage these senior folks, right? Confinement centers, also a big business industry, right? Everywhere there are confinement centers. I was told it goes up to 15,000 to 20,000 ringgit each time a mummy goes in there to deliver. As well as rehab centers, and of course, daycare. Many hospitals are also spending a lot of budgets, infrastructure of daycares, be it for dialysis as well as for oncology, right? To be honest, if you ask me, 1.5 years ago about all this, I wouldn't be able to pitch what I'm doing here. So a lot of things have happened over the last, I would say, 12 to 18 months, the way the private hospitals are embracing technologies. But fundamentally, before we talk about all these IoTs and AI, we have one typical or one major problem that in the earlier forum it was spoken, which is actually interoperability, right? Interoperability is about how you put various systems from company A, company B, company C, and can you push all this data to a single dashboard, right? If you go and talk to nurses or doctors, they will say that, yeah, the procurement department give a purchasing to, or basically they would purchase from 3 or 4 different suppliers, but the data in all over the screens. So how can we put them together? And then it becomes always complex. And when the interoperability doesn't happen, then the data will not be unified. And of course, why all these are required? Because of market trends, customers, demands, whatever the customers have been requesting for, as well as the workflow or efficiency that is being required. What are the main components of smart wards, of smart hospital? The entire word of smart ward itself is very subjective, it's very broad. I would say a couple of years ago, the term smart ward even didn't exist here in Malaysia, right? Park City Medical Center was one of the first one, formerly under Ramsay Samdabi Group, now it's under Columbia Asia, who actually implemented a smart ward solution, right? Because their pain point was they noticed that 20 to 30% of nursing teams' time is being used to open curtains, find remote control for the patient, to on the light, turn off the lights, and then they get inquiry from patients saying that the floor is dirty, I want coffee, change my pillow, all kind of concierge-related requests keep coming to the nursing team, and you have a shortage of nursing team at the same time, a lack of manpower, and you start having all these queries coming in from patients. Hence why the demand of digitalizations for wards came in, right? And interestingly, from our experience all this while, the private hospitals so far, they don't really look into the ROI of all these implementations, interestingly, right? What they want, number one, the solution solve my headcount or workforce problem, number one. Number two, it enhances the patient experience, right? So what are the main components? This is something that we have built or derived ourselves based on the demands from the market that we have. The inpatients get an inpatient app, right? An application in their mobile phone. The patient doesn't need to download and install it. It's basically just a web app, right? And every room in a ward, let's say you have 20 rooms or 30 rooms in your ward. It can be general ward or any ward actually. It has an edge processing IoT hub or IoT server, because typically in any hospitals, everything has to be processed locally. Nothing goes to the cloud. Nobody would like to have things that goes to cloud in China or Singapore or anywhere else. Or even if it's Malaysia, they prefer if they can do it on premise, right? And the patient, it basically allows and enables the patient to manage the room ambience. Some may say, is it a wow factor like hotel or smart homes? But originally that's what we ourselves thought, but actually it's not. A patient could be after a surgery, patient could be on their IV, the patient unable to move in a rehab center, right? Because of amputation or whatsoever, they're recovering and so on and so forth. It allows, enables, empowers them to manage little things that they can do it themselves, right? Why should I bother the caregivers and nurses by simply pressing nurse call button to turn off the light because I want to sleep, right? Cooling system, automation, patient fall detections. You may have a ward of 30 to 40 rooms with 2 nurse stations, and the nurse has to run to room the other corner when she receives a nurse call button or alert, not knowing what she is being called for. Unfortunately, this is still happening. In 2024, a nurse in any private hospitals in Malaysia runs to the room. little simple thing like, please close the curtain for me, right? It's too bright, I can't sleep. Or something more important, that can you please change my IV, right? So where does all this data goes? There's no data. Certain information, so alert the nurses whenever that is required, right? This is the typical scenario of some of the implementation that is actually ongoing, that actually, even in Malaysia, of how you can create a smart patient room, right? A smart patient room that monitors, that creates, and basically gives you the data of everything that is ongoing within the patient's room. This is basically a journey towards a digital twin, right? The concept of digital twin, it's how I can virtually monitor, see a physical space without being in the physical space, right? So this is basically what we are creating, a digital twin of wards for the management to monitor and see whatever that's happening. It can be a little simple things like the condensation level of the room, that room temperature, is it too cold, is it too warm, right? If the patient has been discharged, right, why the room lights, aircons and everything is still turned on, can the nurse turn them off automatically? If the patient not supposed to leave the bed, if the patient has left the bed more than 2 seconds or 3 seconds, can it alert the nurse station, right? So all this data can be pushed. An application, these are just examples so that the audience here can visualize all the concept that I'm actually explaining and pitching. The patient journey has been simplified in very few steps, very few touch points. The moment they are actually admitted, it not necessarily must be us, it could be even our family members, right? Sometimes we could be worried, my child is in the hospital or my mom is in the hospital, but I have to go down to Starbucks to get my coffee for myself, but can I leave them to manage the room by themselves, right? So with these little simple applications, we have a bit of peace of mind, right? I can go on my laptop and do some work while my mom or dad can still manage little things by themselves, right? They can manage everything, even talk to the nurses, text them, or even create a voice chatbot. So we have been also evolving in terms of solution that's being provided. Rather than the patient themselves controlling, can the nursing team also manage everything from the station, right? Whether they hear that, oh, the patient is going to be admitted, I prep up the room. When the patient is discharged, I basically turn off everything,